Hello, everybody. Thank you for joining us today. I'm Tara Haelle, and I am the Health Beat Leader on Infectious Disease for the Association of Healthcare Journalists. AHCJ is the largest organization in the U.S. of health journalists, and we do not accept funding from any corporate interests, including pharmaceutical companies. This webinar is one in a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give you story ideas or resources that you can use in your work. Today's topic is preparing for reporting on autism, vaccines, and related science. As some of you may have noticed, we needed to tweak the speaker list following the Senate hearings of Robert F. Kennedy Jr. to make sure that we could adequately cover enough of the vaccine science that was discussed at those hearings. Joining us today will be Jesse Goodman, MD, MPH, Professor of Medicine and Infectious Disease at Georgetown University and Chair of the E-VAT, the new expert vaccine analysis team that is available for journalists to tap into for resources and expertise. Paul Offit, MD, Director of the Vaccine Education Center at Children's Hospital of Philadelphia and Professor of Pediatrics at the University of Pennsylvania School of Medicine. And Jessica Steier, Doctor of Philosophy and CEO of Unbiased Science and author of an incredible New York Times op-ed that you should definitely check out on how it was attempted to link autism and vaccines. And today, that's what we'll hear. We'll hear from these speakers about the attempts to link vaccines to autism in the past, a connection that has been debunked for over a decade, and the science that shows there is no link. We'll also hear about how to assess the reliability of new research presented on vaccines or autism. Our guests will present and then answer your questions. You can ask questions at any time by typing them into the Q&A space where the question mark is at the bottom of the Zoom frame, and then I will direct the questions to our guests. I want to repeat that we do not have chat on this, and you cannot type the questions into the chat. You need to look at the bottom of your Zoom screen for that question mark, and that is where you type in your Q&A questions. With that, we will get started, and we are first going to hear from Jesse. Dr. Goodman is going to share why this is so important and what's at stake here and what we need to understand about the big picture. Go ahead, Jesse.
Okay, and I'm going to share my screen here. Is that working?
Yes.
We can do that.
We can do that. Okay. Well, I'm very pleased to be here and to, with this incredible group and to also collaborate with the healthcare journalists. And I think it's important to realize that this isn't just some area of debate, that how we evaluate data and science really matters, and that the reason we're here today is it has consequences for people. And I would like to start by saying that dominant beliefs in science are not always right, and we have to be open to new findings, and this is true for all science. But we also have to realize that erroneous allegations and associations can have consequences. And in this case, those can be particularly serious. It can derail the search for the actual truth, which can delay development of needed interventions. It can squander or divert research and treatment resources. We can hurt patients and communities or raise hopes through unsound treatments or beliefs. As we've seen more generally, when people are confused and hear different versions from different people, it tends to undermine confidence in vaccines and public health generally. Incorrect findings may influence policies that affect patient access, and we're certainly seeing that now in the debate over how COVID vaccines should be used. We also have a vaccine compensation system that's resourced, and misinformation could potentially undermine that system, promote unwarranted litigation, and affect investments in vaccine innovation and infrastructure. That can return us to shortages that some of us lived through years ago. For example, when the US lost half its flu vaccine supply in 1 year, because of lack of investment in the vaccine infrastructure. And of course, none of us want to see uh, disease outbreaks fueled, but that could be the ultimate um, problem if confidence is eroded. And then just a quick word on our E-VAT team, or expert vaccine analysis team. This is a multi-institutional, multidisciplinary team that was stood up during the COVID outbreak, um, with a lot of people with leadership experience in the areas you see here. We have previously, as COVAT during COVID, worked with journalists, media, public health, and other partners to provide facts and unbiased analysis on vaccines and outbreaks, with something like 60 on the record Q&A sessions, many of which Paul, as one of our members, contributed to. And the overarching goal is to provide information and help inform decisions that keep ourselves and our communities as safe and healthy as possible. And I've put the link up there to our Fairly Basic website and my email address if I can ever be helpful. And with that, I'd like to stop sharing this, if I can figure out how, and turn it over to
Paul.
Paul.
Well, so I don't have slides. I'll just speak briefly. Robert F. Kennedy Jr. is currently the Secretary of Health and Human Services. He, for 20 years, has been a virulent anti-propagandist, science denialist, and conspiracy theorist, shouting from the sidelines. He's not shouting from the sidelines anymore. He is making policy, and he's making policy often based on what he calls landmark studies or gold standard studies, which to date have been anything but that. So I'll give you two examples. When during his second confirmation hearing in front of the Senate HELP Committee, Health, Education, Labor, Pension Committee, he was asked several times, do you believe, don't you know now, given the data, that vaccines don't cause autism? And he refused to say that. And rather, he said, show me good science and I'll change my mind. And at the end of that hearing, he held up a paper by Mawson and colleagues, which had never been published in a medical journal, never been published in a scientific journal, was not peer reviewed, was critically flawed, methodologically inaccurate, and therefore uninterpretable. And he said this was a gold standard study. It was a study of a Medicaid population of children 8 to 9 years of age, and it was never published for a reason, because it was so flawed. But he called that gold standard science. Then he withdrew our commitment to the Global Alliance Vaccine Initiative, which was a multi-billion-dollar commitment over several years. This is a group that was founded in 2000, has probably immunized 1 billion children in this world, in developing world countries, has no doubt saved 20 million lives. And he said, I am withdrawing our funding to this group because they don't care about vaccine safety. They've been inattentive to vaccine safety. And to prove that, he held up a paper by Peter Abbey, AABY, which was a study in Guinea-Bissau, West Africa, claiming that the diphtheria, pertussis, tetanus vaccine caused the death of young girls. Now, that paper was not reproduced by the same authors years later, as well as a variety of other authors who looked in other developing world countries. And Africa, and the World Health Organization concluded that it was just a study that was in no sense valuable and therefore should be ignored. But he continued to claim that was a gold standard study, and thus withdrew our commitment to the developing world. This is not the end of it. I think he is going to continue to do this. He's going to continue to hold up awful studies that comport with his fixed, immutable, science-resistant beliefs that vaccines are causing autism as well as a variety of other chronic problems. And we need to be on the lookout for that. So I think your group, the healthcare journalists, are an important, I think, impediment to his trying to make claims that just are not scientifically accurate. So hang in there and buckle up. I'm done.
Actually, I'm gonna ask you for one follow-up on that, Paul, before we move on to Jessica. Can you give a sort of a brief overview of how many studies are out there that show that there's no link between vaccines and autism? Just for those who are new to reporting on this. Many of us have seen these for years, but for those who are new to reporting on this, can you kind of give us an overview of that?
Sure. So it's like whack-a-mole. I mean, if it's not one thing, it's another. And so initially the notion was that the measles, mumps, rubella, or MMR vaccine as a combination was causing autism. It wasn't really even a study. It was just a case series of essentially 8 children that had gotten the vaccine and then within a month of that had developed signs and symptoms of autism. And so then it was studied. And really there've been 24 separate retrospective studies that have been reviewed very well by Jessica Steier, by the way, in Unbiased Science. If you want to take a look at one place where you can read that. And then it changed. Then, and like I was on the advisory committee for immunization practices between 1998 and 2003, when we lived through all this, then it was the notion that thimerosal, an ethyl mercury containing preservative in vaccine, cause autism. That was actually easily studied because there were provinces in Canada that used thimerosal containing vaccines right next to provinces in Canada that use the same vaccines, didn't contain thimerosal. There's probably about 9 studies that have now looked at that and all shown the same thing, which is that thimerosal at the level containing vaccines was never harmful, never caused neurodevelopmental delays, but there'll be more. You'll keep seeing more and more studies that are going to be put out there by this administration. I fear they're going to be backed by people like Marty Makary, Commissioner of FDA, and Jay Bhattacharya, who's the head of NIH, which gives that a lot of heft. I mean, they have platforms now that they didn't have before. Anti-vaccine activists now are making policy, and we need to do everything we can to make sure we understand what is a good study and what isn't.
Thank you for all that. And you're allowed, you feel free to enter questions as this is going on. One of the questions I'm going to answer now, only because it's logistical questions about the webinar. This will be available, this recording will be available publicly afterward. So you will have an opportunity to review this. And all of AHCJ's events, our conferences and our webinars are considered on the record. So anything that is said during this webinar can be quoted in any stories that you write. All right, we're going to pass it over to Jessica.
Thank you so much. Really don't love following Paul Offit, but here I go. And thank you to Tara and Catherine for organizing this event, and for all of you for tuning in. As Paul said, we really rely on media, to interpret the fire hose of information coming out and making it understandable for the public. So I did put together some slides. Let me go ahead and share. I will say that I could talk for several hours, so I'm going to do my best to be brief and happy to answer questions in the Q&A. Okay, you can still see my slides, right? I just turned off my video. Okay, perfect. So just a super brief background on who I am. Jess Steier, I'm a public health scientist. My training is in data science, epidemiology, biostatistics, but really in evaluation science. So how to properly design studies of health programs, policies, and interventions. I am the CEO and founder of Unbiased Science. I have my contact information here. Please do not hesitate to follow up with any questions. A little bit more about Unbiased, just so you know who I am and what I'm all about. So like I said, I started in data science, but I've pivoted to science communication in response to a ton of questions that emerged early in the COVID-19 pandemic. We put out infographics on social media. I do long form content on Substack and Medium, also have a podcast. And my whole thing is just really sharing the best available evidence, helping people navigate and critically appraise, like I said, the fire hose of information that's being hurled at us, and to try to do so in a way that's empathetic and meets people where they are. So on August 19th, I had this amazing opportunity to publish a guest essay in the New York Times. Incredible shout out to the team at the Times. They were fantastic, in particular, Sarah Chodosh and Taylor Magicomo, who are on the digital media team. Please do go check out the article. They brought it to life with their digital integration. It's very interactive. And then the following Sunday, it came out to print, and there I am in my Sunday best, holding up the article. It was really an amazing opportunity for me. But the main thesis of the article was this upcoming federal autism study being led by RFK Jr. and David Geyer. And I put a question mark after David Geyer's name because recently in a Senate hearing, RFK was questioned about whether David Geyer would be in charge of this study. And he sort of backtracked and said, no, that's not the case. No matter who leads the charge, there's sort of a playbook that I'm hoping that you'll all walk away with to help you sort of identify shoddy studies in the interest of public health. So let's get into it. I share some clips from both the article as well as the Times did a social media post that paired with it. So I just want to give a total shout out to the Times. These are screenshots from that piece. So a little bit of background on David Geyer and his father, Mark. Mark has since passed away, but they're infamous for deeply flawed studies claiming that vaccines cause autism. Putting the quote unquote research studies aside for just a moment, they created an illegitimate review board that was composed of themselves and their friends and associates. They promoted a drug, a chemical castration drug called Lupron, as an autism treatment. They were charging people $5,000 to $6,000 a month. The father, Mark, his medical license was revoked in all 12 states. And David, who does not hold an MD, he holds no degree in science or in medicine, he was fined for practicing without a license. What I'll share here, again, this is not specific to the Geyers. There are many others we suspect are being eyed for this research who have questionable backgrounds. Paul mentioned Mawson. He's another sort of common name in this circle who's put out this shoddy research. And again, what I hope to share here today will not be specific to the Geyers. So here, and Tara, you had asked how many studies have been done. So I hope that this answers the question. Again, this came from the Times piece. As Paul indicated, this all started back in 1998. We had Andrew Wakefield, a British doctor. He published this study, and I hate to even use the term because it's not a study. He tried to link the MMR vaccine to autism. It was later found that he falsified data. He was receiving funding from lawyers and lawsuits against vaccine manufacturers. He himself was trying to come up with a rival vaccine. So there were lots of ulterior motives, financial motivations. The paper was retracted. He was barred from practicing medicine, but his work, unfortunately, has had a ripple effect, and we're still feeling those effects today. So since then, there have been 70 or so studies that have looked for any link between vaccines and autism. And the Times team did such an incredible job. In orange, you could see that there were 26 studies that came up. They found some link between vaccines and autism. And then in blue, you'll see there were 43 studies that found no connection between vaccines and autism. When we did digging, we found that a whopping 2/3 of the studies that claimed to find a link were written by the Geyers. And again, I could talk about this for hours, but the studies, if you actually look at the individual studies, they've been heavily criticized by myself, by many others, for using deceptive research techniques and flawed data. And among the 8 other studies that the Geyers did not author that claimed to find a link, 4 were retracted for data manipulation, flawed methods, or undisclosed conflicts of interest. And most of the authors involved in those studies have been involved in some sort of anti-vaccine campaign or have had other papers retracted. So the scientific reality is that we have at least 43 very high quality studies that have involved close to 6 million people across several countries that have found no connection. There's a great recent study out of Denmark that's very robust. It was a quasi-natural experiment. I'm happy to talk more about it, but it looked at 50 different health outcomes. It included autism. It also looked at ADHD, asthma, and other outcomes. It was incredibly robust, and it found no association between vaccines and autism. So I want to sort of map out some of the tactics, the playbook or red flags of poor study design. So here I summarize them. I'll go into a little bit more detail briefly, but the first is something that we call p-hacking. So this is when someone tests multiple outcomes, and if you look hard enough, you're going to find something simply by chance, right? It's like throwing spaghetti at the wall to see what sticks. So we, in the New York Times piece, we picked this one particular study that was authored by the Geyers. This is from 2017, and they were looking at thimerosal-containing vaccines and autism as an outcome. And interestingly, they zoomed in on atypical autism specifically, and I'll talk more about why this is problematic, but it seemed to us very obvious that they were just looking, they were looking for some significant outcome, and they landed on atypical autism by chance. They
Yes,
also,
sorry, I'm gonna jump in real quick. Can you enlarge that a little bit so that I don't know if
oh,
people can see it as well? Can like
sure.
yeah,
Yeah,
sorry.
I'm sorry. Is
I don't know, I
that,
don't know what program that is. So I was trying to see if it could just fill the screen a little bit more.
oh, let me see here. And I'm so sorry.
That's okay. If you can't, that's I mean, I just yeah. I mean
Is
that not much
is
helps.
is that a little bit better? Okay. Okay, great. So another thing, and I'll talk more about this, another telltale red flag is who's being compared. And I cannot underscore enough that you have to make sure you're comparing apples to apples. And what Geyer and what many others have done is they compare apples to oranges. So they compared kids, and again, I'll talk more about this, their cases, so the children who did develop or who were diagnosed with autism between 1991 and 1998 to controls from a completely different time period. And I'll talk about why that's problematic. They completely ignored confounders. And I'll define this term. A confounder is something that basically is clouding the relationship between the two variables that we're really interested in, right? So if we don't account for things like healthcare access or socioeconomic status or parental age, that's a problem, and that's likely clouding the relationship, right? That we're trying to study. Another thing is there was a self-citation loop. So they were only citing their own flawed studies. I'll demonstrate this in a moment. And if you look at what they're talking about, they're misrepresenting sources. So when we're talking about mercury, so there's thimerosal, which is no longer in vaccines, but it's a specific byproduct of mercury, whereas there's something else called methyl mercury. It's a completely different type of mercury that's actually a lot more harmful than ethyl mercury. So there were a lot of issues, specific issues with some of the things that they pointed to in their studies. So I wanted to zoom in on this issue of why they focused on atypical autism. So it is perfectly okay. It might be, maybe it is, possible that there is a specific subtype of an outcome that we're looking at, right? That where there could be an association. But without providing a reason, there was no biological plausibility. There was no hypothesis why they would look at such a narrow diagnosis. And so this points to, again, something called p-hacking, where you're testing multiple outcomes until you find one that shows a link by chance. The other thing, and I cannot underscore enough how egregious this is, they compared two groups. They compared people with the condition, these are our cases, and similar people without it, which are our controls. And we would, in an actual robust study, we would need them to come from the same time period, right? Because there are going to be other things that changed over those, the course of that time period that might be impacting your likelihood to either get vaccinated or to get a diagnosis of autism. That's why it's so important to look at kids in the same time period, and they did not do that. So they compared children with high vaccination rates and a broad definition of autism to children with low vaccination rates and stricter autism criteria. So from the get-go, again, we're comparing apples to oranges. They also ignored confounders, right? So again, these are outside factors. So in particular, a very big one when we're talking about things like vaccines and autism is healthcare access. Because healthcare access, you're more likely to, if you're seeing the doctor, you're more likely to both get a vaccine and you're more likely to get a diagnosis of autism. And so this can create an appearance of a connection between two things. And unfortunately, they dismissed the idea that they had to control for this and other confounders. And what did they do? They cited studies. If you look in the top right-hand corner, you'll see an orange square that encompasses the studies that they're citing as reasons why they didn't have to control for confounders. These are all authored by the Geiers. So they're citing themselves, their own studies, for reasons why they did not have to control for confounding variables. Moving on, and Tara, please nudge me if I'm too
No,
long-winded
you're fine.
here.
I just
Okay.
realized, can you hit that
Oh.
present button in the upper right corner? I wonder if that would make it easier. Do you see the word
Oh,
present?
oh, you know what? I'm sorry. It was being blocked by my little thing here. Hang on. Wait, something's happening.
Just the
Let
purple
me
at the
see.
bottom.
Yep.
Yeah.
Did that do it?
There we go. Yeah, perfect. Great.
Okay,
Thank you.
let me just figure out how to minimize this. There we go, because then I can't see. Okay, perfect. So I would argue that we are not actually facing a quote unquote autism epidemic. And there's really good research, this Swedish study that I'll talk about in just a moment, that shows that it's much more likely that it's better awareness and screening for autism, broadening of diagnostic criteria, especially in 1994, there was a major change. And while it is possible there might be some genuine factors, like we do know that there appears to be some association between older parental age and the likelihood of autism diagnosis, more likely it's that we are diagnosing this more. It's not that there's suddenly a surge in autism, right? And so there was this great Swedish study that they were looking at the prevalence of autism symptoms, the phenotype, and then also compared that to clinical diagnoses of autism. And while autistic traits were observed at a relatively stable rate, the rate of autism diagnoses more than doubled over a decade. Again, pointing to this idea that it's actually better awareness and screening, and not that we're in a quote unquote epidemic of autism. So zooming out, how to spot falsehoods, I just put this together. I hope it's helpful. And frankly, it's actually not specific to vaccines and autism. But generally speaking, when you're relying on a single study or a subset of studies that go against the overwhelming scientific consensus or the overwhelming body of evidence, that's a red flag, right? You can always find a study that supports a specific conclusion, right? But studies are flawed. Not all studies are created equal. And that is why we rely on the body of evidence. And the body of evidence tells us that there is no association between vaccines and autism. Also not specific to vaccines is this use of preclinical or in vitro, so non-human research, to extrapolate to humans. I actually see this quite a bit when we talk about things like food dyes or food additives, where yes, we could say that this dye is causing cancer, but we're relying on rat studies where rats are exposed to, 1,000 times the levels of dyes that we would ever realistically be exposed to as humans. Another issue, also not specific to vaccines, is when we talk about risk, when you don't specify dose, right? So there's this fundamental principle in science where the dose makes the poison. So just saying that something is harmful, that really is meaningless unless you're specifying exposure levels. Improper study design. So it's so funny. I remember when I was doing my training, I always got so wrapped up in the statistics and the numbers. Really, your focus should always be at the design. So before we even get into statistical analysis, what are the groups that we're comparing? Are we comparing apples to apples? Because if there's no comparability between the two groups that we're looking at, that introduces so much bias, and it means that there are these other variables that are likely clouding the relationship that we're trying to study. And on that note, proper controls for confounders. This is like stats 101. We must control for these variables that are likely introducing bias. I mentioned that not all studies are created equal. Every study has its limitations. Just zooming out for just one moment, Jesse, I know you could certainly talk about this as well, but there are experimental studies, there are observational studies. I think folks know that, RCTs, randomized controlled trials, are often lauded as the gold standard, but sometimes there are reasons why we can't do RCTs, right? So, well, actually, just taking a step back, what makes it experimental is that the researcher is assigning the exposure, right? So the researcher is deciding who's going to get a vaccine or who's not going to get a vaccine, for example. But there are some ethical considerations. So if we know that vaccines are safe and effective, it would be unethical to withhold that from a group of children, right? And so we often hear RFK and others say, well, we need to have these randomized double-blinded RCTs that have these saline placebos. Well, no, we can't compare to placebos in all cases, saline placebos in all cases, because it would be unethical to do so. And so instead, we'll compare to other types of placebos, right? Or other types of vaccines, for example. And just one other note on this, and apologies again if I'm talking too much, but observational studies, that's so where I said experimental studies are where the researchers controlling who's getting exposed. In observational studies, we're just observing who in the population, for example, is getting vaccines and not getting vaccines. And that introduces bias because there might be other differences between those groups, right? Differences in people who are more likely to get vaccines versus not likely. And again, this is why it's so important to control for confounding variables. In literally 1 minute, I just wanted to mention briefly, because I'm sure you've all seen the news.
This was going to be my first question to you.
Oh,
So you're just
oh,
nailing it.
Oh, okay. And please do, again, like I said, just jump in if I'm too long-winded here. But the Wall Street Journal dropped last week that it seems that RFK and HHS, they might link autism to Tylenol use in pregnancy and folate deficiencies. And so it just, a lot of us have whiplash, and it's unclear. We don't know exactly what it's going to be in this autism report. Many of us have suspected that it would be vaccines, but maybe we've done such a good job making the case that we have all this evidence that points to there being no relationship that they're trying to point to something else, right? Because they made this big promise so that we would have the quote unquote cause of autism by September. And here we are in September. So super briefly, there was this meta-analysis of 46 studies. I'll talk about it in just a moment. And it seems to be that that's really the basis for this claim. But the lead author actually explicitly stated that you cannot answer this question about causation. Notably, one of the senior authors served as an expert witness for plaintiffs in acetaminophen litigation. And so many of us have looked into this, and when we actually look at the research, it is absolutely not at all convincing that there's any link. So I published this Substack last week. It was super high level, but when I looked at, when I did a little bit of digging, there was this great Swedish study that included 2.5 million children, and about 185,000 of those children were exposed to acetaminophen in utero. And initially, before controlling for anything, it did look like there might be some modest association, a 5 to 7% increased likelihood of autism as well as ADHD in children who were exposed. But the researchers realized, well, hang on a second, because the mothers who took Tylenol, they were different than the mothers who didn't, right? They had higher rates of infections, chronic pain. They also had higher rates of psychiatric conditions, and they also had higher rates of ADHD and autism in their families. So what they did was they included siblings in this study as sort of a proxy for genetics. And when they controlled for genetics, the association completely disappeared. So that super modest increase of 5 to 7% dropped to 0%. This study was really great because they also looked at a dose response. So they showed that even high levels of exposure to acetaminophen in utero showed no effect when we controlled for this. And also, this is just super dangerous for a lot of reasons, but not the least of which is that if you have a fever while pregnant, that is actually risky, right? It could increase the risk of neural tube defects, spina bifida. So that carries its own risks. So we definitely don't want to just, scare pregnant people right out of the gate about using Tylenol when the research is not at all robust.
I'm going to jump in for just a moment.
Oh, yeah, sure.
Slide for a moment.
Sure.
I'm going to point something out. That confounding problem. The term for that in research is called confounding by indication, which means that the reason that the medication was indicated in the first place is also the thing that may be related to why the outcome occurs. And I want to mention that only because we have an AHCJ blog post on confounding by indication from way back in like 2016 or 2017. And the ironic thing is that it talks about Tylenol being used to show that the increase in asthma in kids. So Tylenol has been the victim of confounding by indication in the past. This is not something that we're unaware of. I just wanted to point that out for people. Go ahead.
Thank you. So I just wanted to include the citation for that meta-analysis that's being talked about, and just a little bit more context. These are just screenshots from this study. So really quickly, a meta-analysis, the authors themselves said that a major limitation of this is that there was so many differences between the studies that they were looking at in this meta-analysis that they could not combine the data and do their own analysis. And also just here, I don't know if you could see my cursor, but at the very bottom in the discussion, the authors themselves said that, first of all, they were saying that this is just correlation, not causation, meaning that, you know, just because we're seeing this, we can't say definitively that Tylenol use in pregnancy caused this outcome. And I have this fun infographic on the right-hand side of the screen where I tried to illustrate this point, right? That correlation doesn't equal causation. And a classic example is that we see, you know, shark attacks and ice cream sales are correlated, but of course it's just because we're more likely to eat ice cream in the summer, people are more likely to be swimming in the summer, and hence they're more likely to be shark attacks. But certainly ice cream is not causing shark attacks. And actually, the authors themselves do not recommend broad limitation of Tylenol use in pregnancy. They just recommend judicious use, so lowest effective dose, shortest duration, and of course, you want to, you know, this should all be done under medical guidance. And here I also just wanted to include the citation for that Swedish study that I mentioned. Here on the left, you'll see this was a massive study. 2.5 million children were included. And where is it here? I wanted to show you. Of course, I pulled the wrong screenshot here, sorry, but that over 185,000 children were exposed to Tylenol in utero. So this was a very robust study. And again, the fact that they controlled for siblings was huge. And their main takeaway was that sibling control analyses found no evidence that acetaminophen use during pregnancy was associated with children's risk of autism, ADHD, or intellectual disability.
All right.
Yeah.
Okay.
No, super, literally, I promise in 30 seconds, and then I will shut up, and I apologize for talking too much here, but
okay, I didn't know, I thought you were done. Sorry, go ahead.
Yeah, so super last thing, I'm a part of an effort. Here you could see our website on the bottom. We're called the Evidence Collective. So I've joined forces with a bunch of other science communicators. So we're all scientists in our own right. We're also science communicators. And so we put together, in addition to communicating to the public through our own social media, we also put together these briefings for public health leaders as well as media. So we're just getting things off the ground here, but we welcome you to use it if it's helpful as a resource. But just as an example, last week we watched the Senate hearing, and we did sort of a round of debunking. And one of the claims made during that hearing that felt super relevant to this conversation was Kennedy mentioned referenced this long debunked link, of course, between vaccines and autism, and he specifically claimed that Black boys who receive the MMR vaccine have a higher autism risk. And I just wanted to mention briefly where this came from. This claim stems from Brian Hooker's 2014 reanalysis of a 2004 CDC study. The original CDC study found no link. He applied different statistical methods to the same data, and he claimed that African American boys vaccinated before 36 months had, 3 times higher autism risk. However, the study was retracted, and you can see the formal retraction here on the right-hand side of the screen. It was retracted due to invalid statistical methods, failure to control for confounding factors, and undeclared conflicts of interest. So if you're wondering where that stemmed from, that is it. So I'll stop sharing and would love to answer any questions.
Thank you, Jesse, Paul, and Jessica for helping us with this today. So we have a lot of questions already. We'll try and go through these quickly. The first question should hopefully be a fast one for Jessica. Since autism is a complex condition and it's not fully understood, this person asked, how can anyone definitively prove a causal link? I'm going to tweak that a little bit and ask, if there were a link between vaccines and autism, what would that study look like? Like, how would you know if you were looking at the study and it did show a link?
So I would say we do have those studies that do properly investigate it, like that recent Danish study that just came out that was massive. It included, I think it was 1.2 million children. It was great because it was, and I'll try to answer this briefly. It was a sort of what we call a quasi-natural experiment. So over time in Denmark, there were changes in vaccine policy. So it sort of presented a natural experiment where we were able to look at changes in exposure to vaccines, and while we were also monitoring outcomes, autism diagnoses. And it was also great because they looked at dose response. They were able to see, okay, well, children who received more, they were looking specifically at aluminum containing vaccines. So they looked at, children who received more of these aluminum containing vaccines. So they did super rigorous analyses. They were looking for dose response. They did subgroup analyses. I don't know if I'm answering your question, but that I would point to that as a great example of a very robust study that did examine this topic properly.
And this question could be for Paul or for Jessica. We were discussing this before this started. There's a vaccine monitoring side effects system called VAERS, which stands for Vaccine Adverse Event Reporting System. It's a system anyone can report to. I've seen a lot of studies that try and link something to say, oh, this is caused by vaccines using VAERS. Can you give an overview of why that's problematic? If we come across a study that uses VAERS, what journalists should look for to see if it's an actual valid study in terms of what it's claiming to say?
Okay, I'll start and then turn it over to Jessica. So the Vaccine Adverse Events Reporting System was created as part of the 1986 National Childhood Vaccine Injury Act. And the goal was so that anybody who experiences or believes that there was a side effect, an untoward side effect associated with a vaccine, could then report to this system. It's easy to report. You just fill out a brief form online, and anybody can report. Doctors, patients, personal injury lawyers, anti-vaccine activists, pro-vaccine activists, anybody can report. And it's a very noisy system. The best thing you can say about it is it might raise a hypothesis to be tested. So for example, when the mRNA COVID vaccines came out initially in December of 2020, they were initially tested in totally 35,000 adults, and then they're given to tens of millions and hundreds of millions of people. And so is there a serious, rare side effect that may not have been picked up before the vaccine was authorized? And there was. It was picked up initially in VAERS, where you saw that there were reports about myocarditis, this inflammation of the heart, within 4 days of the second dose, primarily in 16 to 29-year-olds. So was that real? Were you more likely to develop myocarditis if you got that vaccine than if you didn't get that vaccine? The only way to answer that question is to look at a vaccinated and unvaccinated group, which you can't do in VAERS. VAERS is I got a vaccine, then I had a problem. But you need more information. You need got a vaccine, didn't have a problem, didn't get a vaccine, had a problem, didn't have a problem. So you need 4 pieces of information. So when you did that through the vaccine safety data link, you saw that there was an increase of myocarditis in a vaccinated versus unvaccinated group. But I think probably the best example of how weak this system is there's no discarding anything that's reported. So there was a physician in California, Jim Laidler, who reported that he had received the influenza vaccine and then had turned into the Incredible Hulk. And so that's in there. So if you want to just look at that, you can say influenza vaccine caused you to turn into the Incredible Hulk. And that's the problem with VAERS. And I think we should pay a lot of attention to that, because I think this group, this anti-vaccine group that is now in charge, is going to be using VAERS to claim that there are proofs. And that is not how you prove it. You prove it, you have to have a vaccinated and unvaccinated group.
Unfortunately, it's not in there anymore. They asked him to remove it and he did. I wish it were still there.
Can I just one thing
Go
to
ahead.
add, is, I mean, everything that Paul said, obviously, we can't use VAERS to determine causation, right? I think we need to take a step back to realize what VAERS is and why it is a great public health tool, but I think we forget that it's really, first of all, it's a passive voluntary reporting system. So anyone can report anything, right? And we have had these instances of the Incredible Hulk, people reporting car accidents, things that are not at all, can't possibly be related right, to vaccination. It's used by public health experts as an early warning system, right? As a signal. So if we see a number of signals, a number of reports, we can then go in and investigate, okay, what is going on? Is this a true signal? But it is not intended to be used by, studies to prove causation. So it's unfortunate to me, I know others, agree that it serves a purpose, but it's being used for reasons it should not be used. And that's really problematic.
This is a great question that I think all journalists have on their mind right now. For years, we have relied on the data from the NIH, the CDC, the FDA. That was what we considered authoritative, reliable sources. And now we're in a situation where we're not sure if we can trust it. We even had Rochelle Walensky recently in Stat say that the CDC is no longer a reliable source of vaccines. We're going from listen to the CDC to don't listen to the CDC. What do journalists use now for authoritative sources? How can we, especially those of us who may not be able to comb through all of the research evidence, where can we go? What can we link to be sure that we are finding the reliable information for ourselves as reporters, but also that we're sharing it with our audiences? I don't know, that might be a Jesse question, or a Paul, or Jessica. Okay.
Jesse, why don't you answer that, Jesse?
Yeah, I think we're all very challenged by this. And I think one of the purposes actually of this webinar is to sort of say, what are the questions you can ask right up front when you see data, whatever the source is? And I think Jessica hit on those really well. So I think people do need to take more of this on. I think where the data are not clear-cut or consistent, or where there's controversy, then speaking to independent experts like those of us on this call can be helpful. And also, it's been wonderful to see the professional societies, the healthcare providers like the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, step in where there was controversy and government recommendations suddenly changed and didn't make sense. And they got together their expert groups of people who really are scientists and really take care of patients to look at the data. But I think there's no question we're in for stormy weather here when we can't 100% rely on the government for information. And it's not just that we can't rely, it's also that they were an important source of the actual data. And that is partially going away. So I think it's that we have to all take on ourselves more of the responsibility for looking at the data, more of the responsibility for consulting other independent experts. I don't have any other great solutions. And I think we should demand accountability, that just as we demand for Homeland Security that our government should provide that, we should demand that for health security. And it's not providing it when it's not providing accurate information.
Thank you. That's helpful. And another question about what's going on right now. We've got the FDA restricting the COVID vaccine to a limited population, and we're watching some states, Massachusetts, New Jersey, New York, Colorado, take sweeping steps to preserve vaccine access. And then we've got some other states like Florida that are free for all. What are your guys' thoughts on whether more states should be taking similar steps like those that we're seeing in the Northeast and also in the Pacific Northwest? I know Oregon, California, and Washington have banded together, I think with Hawaii as well. Is this a good idea? Does this increase confusion in the public and therefore increase risk? Or what should states be doing in this environment, and what would be helpful?
I don't know if Paul or Jesse want to
For
jump in. I mean,
anyone.
I would say it is causing confusion, but I think it's necessary. It's being done in the interest of public health, and I am not a policy or legal expert, but I know that it's not an easy process, right? You have to also be mindful of people who are giving vaccines are concerned about litigation. We have to be concerned about access, insurance coverage. I mean, that's why so many of us get frustrated when we hear RFK say, well, anyone who wants a vaccine can get one. Well, that's not entirely true. We've seen major pharmacy chains are not ordering the vaccines. There's total confusion over, will insurance companies provide coverage? Because yeah, if you walk into a pharmacy, let's say you could even get a vaccine, you might need a prescription if you fall outside of those who, are currently recommended to get the vaccine. Well, you have to pay out of pocket for the vaccine. There's so many considerations. Sorry, Paul, I think you unmuted and we're going to say something.
The only thing just to add to that, I think probably the best example is something like giving the COVID vaccine to women during pregnancy to protect not only them, but their unborn child. So previously, the ACIP had made that as a recommendation because it's clear that you are 1.5 times to 2 times more likely to be hospitalized and to go to the intensive care unit and be mechanically ventilated if you're a pregnant woman who has who's infected with COVID as compared to a woman of reproductive age who is not pregnant and has COVID. So pregnancy is a risk factor. That's why pretty much every country in this world considers it a risk factor. But RFK Jr. stood up and on a 1-minute video on X said that HHS is no longer going to be recommending that vaccine for pregnancy, and it disappeared from their at least part of their site on the where it lists the schedule. It said under pregnancy for COVID, no recommendation. And I have had many emails from women who are saying, I'm going to the pharmacist and I can't get them to give me the vaccine. There's questions about insurance coverage, and for the pharmacists, often they will say that their rule is that they will give any vaccine that is recommended by the ACIP. So if it's not recommended anymore, then they can't give it. And so here you have a group that is clearly at risk, that is now having trouble getting the vaccine. So when RFK Jr. says, I'm not going to take away vaccine from anybody who wants it, that's not true. And Marty McCarry was just on CNN yesterday in front of Kate Baldwin's show, and she challenged him on that. And he just quickly, sort of glibly said, well, you can't get it at Starbucks, but there's no problem getting it. I really wonder whether they have any idea what's going on the ground, but I think confusion is the point. I think confusion is the goal.
This is a quick question for Jessica. Do you know of a good resource online or a book that for people who want to do kind of a refresher on methodology analysis, like kind of a lot of what you just went over, but maybe more in detail? Do you have any recommendations?
This, I feel like it's embarrassing to self-promote, but honestly, I mean, this is really the entire basis of what I'm trying to do at Unbiased.
Hey, that works. That's fine.
Yeah, and there'll be a lot more of that, but exactly this and how to communicate to lay audiences. Just really briefly, I just wrote something. I had a chance encounter at a bar with these 4 guys. I overheard them talking, and COVID vaccines, mRNA technology came up, and I sort of walked through. These guys had no technical background in science or medicine, how to navigate the conversations, in a way that's respectful. You're bringing in the best available evidence, but how to communicate about very complex concepts in a way that's digestible. So sorry to self-promote, but there are other amazing resources as well. Lots of other science communicators. I'm working with Caitlin Gettelina. You're a local epidemiologist. We're the ones who co-founded the Evidence Collective, and there are many others.
And also, someone asked about the vaccine safety data link database. I'm going to have Andrea post into the chat with an explainer on that, which is a CDC link because it's with the CDC. But sorry, there's so many questions here, and I'm trying to. One of the things that we hear a lot from Kennedy is, I'm not anti-vaccine, I am pro-safe vaccines. This is a really common tactic. I know those of us who have been in this game for a while. I mean, I can point to a citation that discusses this, but can you give us some examples of the kind of misdirection like that they use, and what journalists should do when they say something like that? Like how should journalists communicate to their audiences that that's essentially a misdirection and a dishonest response, really?
Right, I'll start. I think when RFK Jr. says he's interested in vaccine safety, what he really means is he's interested in finding studies that support his fixed, immutable belief that vaccines cause harm, especially cause chronic diseases like autism and others. So he will very quickly dismiss any articles that show that he's wrong, and very quickly do his one-trick pony thing, which is to say everybody's in the pocket of the pharmaceutical industry. That's what he means. When he says gold standard science or landmark science, he usually means something that supports his point of view that is invariably a methodologically flawed study. He doesn't mean it. He doesn't mean, I mean, the vaccine safety data link is a perfect example of a great system that is this linked, computerized medical record system that involves a fairly decent percentage of the population, including hundreds of thousands of children, so that when a vaccine is initially authorized or licensed, you know, you're testing it in tens of thousands of children or people. That's not hundreds of millions of people. And so there are rare adverse events which can be serious. And I think there's probably no better example than in February of 2021, when our committee approved the use of the Johnson & Johnson adenovirus vector COVID vaccine. So then it was out in the world, you know, being given to millions of people. And it was found fairly quickly to be a very rare cause of clotting, including clotting of the brain, including fatal clotting of the brain. It was, you know, in the range of 1 in 250,000 people. That's not the kind of thing that's going to be picked up in a pre-licensure study, but it was very quickly picked up with the vaccine safety data link. So there is no hiding. I mean, if a pharmaceutical company wants to misrepresent data or omit data, it is going to be found out in the vaccine safety data link very quickly. And for that reason, then, that vaccine was taken off the market in May of 2023 because we care deeply about safety. Of course we do. I mean, everybody who sits on these committees, whether it was ACIP, but when we still had an ACIP, or the FDA Vaccine Advisory Committee, cares deeply about safety because it's an awesome responsibility. You're giving vaccines to healthy people, including healthy children. So his notion that only he cares about safety means he only cares about things that he believes to be true that invariably aren't true. He is the last guy to be looking at science, given his history for 20 years of ignoring science.
Speaking of ACIP, can you speak about what you were a former member of ACIP in the past, and you were, well, up until last week on VRBPAC, the similar one at the FDA. For some reason, you just were seriously removed from that committee. Could you talk about what ACIP's role has been, like what they do with the evidence they have, and are they looking only at published evidence, or do they have access to evidence that the general public does not have it? And further on to that, because their recommendations have previously established the standard of care once the CDC accepts them and passes it, are physicians at risk for malpractice if they contravene those recommendations and what the CDC eventually approves? And you know, how does that work basically? How does it work and how is it going to work going forward?
Okay, so I guess I can start and then turn it over to Jesse and Jessica. So the ACIP is composed of people who have an expertise in a variety of fields, whether it's virology, microbiology, statistics, epidemiology. They're invariably or often clinicians, public health people who will counsel people about vaccines or have certainly seen vaccine preventable diseases. So collectively, they have an expertise where collectively they will have read often the papers that they're being asked to comment on, so to make a decision about. I think that in terms of, and so that's who the ACIP was. They're not that anymore. They've been replaced by 7 people who collectively, with the exception of arguably one person, don't have that expertise. And so we're about to get some, I think, awful advice and from the ACIP and by extension the CDC. So I agree with people like Tom Frieden and Rochelle Walensky that we shouldn't trust them anymore. I think that's true. But that's what the ACIP was, and they take it seriously. And, you know, I think it would help if Robert F. Kennedy Jr. went to one of these meetings before he fired everybody and really listened to how much people care. I remember I came onto the ACIP in 1998, and I was really a rotavirus immunologist. That was really why I was asked to be on the ACIP. So I've mostly been inoculating mice in windowless concrete block rooms. You know, I really had little understanding of public health, but I was really impressed. I was asked to be head of the polio working group and talking with the people there who are so dedicated to trying to get it right, so dedicated to not only the public's health in the United States, but the world's health in many ways. And it opened my eyes to what public health really was. And it's so hard for me to watch this all getting torn to shreds.
Okay. Did anyone else want to say anything to that, or Jesse? Did you? If not, I will say we've got 1 minute left. Maybe we can go 5 over. I don't know, but we've got a lot of questions. I've noticed a lot of the questions have to do with how to communicate this information to people, and a lot of questions have to do with how to address vaccine hesitancy. Those are excellent questions, and what I've done is take screenshots of those because I think AHCJ can offer future webinars on those with different experts who specifically focus on vaccine hesitancy. Let's see here. do any of you want to address the, sorry, there's so many questions. I'm trying to see one that's fast that we can ask here. If the, can any of you give us a preview of what you think is going to happen at ACIP next week? What should we expect? What should reporters be prepared for? What might happen that they're going to have to press back on? You know, a lot of reporters are getting ready to cover this, and they're going to need to be ready to report on things very nimbly. What do you suggest they watch out for?
A lot of misinformation about the COVID vaccines, that there have been all of these deaths, especially among children due to the COVID vaccines. There is zero evidence of that. That we did not study the COVID vaccine in children, also completely untrue. So my eyes are on the COVID vaccine. I think Hep B is something that keeps cropping up. RFK did an interview with Tucker Carlson where he brought up Hep B. So I'm concerned about that birth dose, which is overwhelmingly safe, and has been such a critical public health tool. And then I believe it was on the agenda that we were supposed to talk about last time, the MMRV vaccine, with measles, mumps, rubella, varicella. Why am I blanking right now? And so I would be concerned that they're going to start looking at specific vaccines. They might cherry pick some studies or claim that there are studies that have found adverse events where there aren't. I could see them focusing on specific ingredients, like it used to be thimerosal. Now I'm concerned that we're looking at things like other like aluminum adjuvants, which we don't have any evidence of of harm. So those are the types of things that I'm concerned about. I don't know, Jesse, Paul, if you had any other thoughts.
No, I agree. I think it's going to sow more confusion, and they may, like they may formalize the non-recommendations for children, which, would concern me because those were things done at the FDA level in terms of the updated approval. So, yeah, I think you hit on the main things, but I think it's going to sow a lot of doubt. They may do something like say, well, why, which they frequently said the Hep B vaccine should just be for people at high risk, let parents choose, things that are going to end up endangering people.
And thank you, Jesse. Unfortunately, we are at time, and I know there are so many questions that were not answered. One quick yes or no question, Paul. Does ACIP does have access to some data that the public may not have access to, right?
I'm sorry, the ACIP has access to what?
To some data that the public does not have access to?
Yeah, no, that's true. I for the COVID vaccines, for example,
Okay.
you had whatever 200 pages submitted by the company to describe their mRNA vaccines, another couple hundred pages by the FDA. So they'll have access to those data, which the public may not initially have. But usually when the presentations are made, those presentations are immediately available to the public.
Okay. I've taken screenshots of these questions. I'm going to try and get answers to them for some of you for future things. And like I said, we'll try and plan some future webinars that address some of these. Thank you guys all so very much. I'm sorry that we couldn't get to all these questions. And I really appreciate your time, Jesse, Paul, and Jessica. This was fantastic. Thank you.
Thank you.